welcome. Thank you so much for joining us today. My name is Claire Simmons. I am a communications director at Atrium Health, and I'll be serving as your moderator for today's lung cancer conversations. This is a limited edition series we are hosting right here on Levine Cancer Institute's Facebook account. We have gathered all the experts available who cover lung cancer in some capacity to share their insights with you. We know you have a lot of questions, and it can be a lot as you navigate a lung cancer diagnosis. So we hope that these series and these talks will provide some much needed source of information and just to reassure you that you are not alone as you navigate a lung cancer diagnosis. So without further ado, we'll go ahead and get started by introducing our experts in today's conversation. We have Dr. Jeffrey Hagen, Susan Yaguda, and Dean Quick. So Dr. Hagen, if you want to just go ahead and say hello, introduce yourself, and then Susan will kick it off to you as well.
Yeah, hi, I'm Dr. Jeff Hagen. I'm the Chief of Thoracic Surgery at Sanger Heart and Vascular Institute at Atrium Health and the Director of Thoracic Surgical Oncology at the Levine Cancer Institute. And my specialty or my clinical interest is in lung cancer surgery, specifically robotic thoracic surgery.
Susan, would you like to say hello and introduce yourself?
Sure. My name is Susan Yaguda. I am the manager for integrative oncology, which is one of the sections in the Department of Supportive Oncology.
Thank you, Susan. And Dean Quick, if you could please say hello and introduce yourself.
I'm Dean Quick. I'm the board-certified music therapist for Levine Cancer Institute in the Integrative Oncology section of the Department of Supportive Oncology.
All right, so Susan, we are going to go ahead and start off with some questions that we have for you. So our first question is, what are some types of integrative care that patients can do to optimize their health prior to having surgery?
Yeah, that's a great question, Claire. So we like to look at things from the perspective of mind, body, spirit, and really looking at optimizing all areas of health for a patient before they're going into a pretty major surgery. For one thing, knowing that not all people diagnosed with lung cancer are smokers, but some are indeed and could use some help and support in tobacco cessation. So we offer those kinds of education and services and resources so that we can really partner with patients to quit their tobacco use prior to surgery. In addition, we want to also get them connected with appropriate specialists so that they can be moving as much as possible, but in a safe manner. So we know that remaining physically active throughout treatment is something that helps reduce some of the side effects from treatment, but it also is just going to help in maintaining some cardiovascular health, which is going to be, hopefully supportive of a better outcome surgically. We also partner with our dietitian team and really recommend patients eat as healthfully as possible, focusing on whole foods and making sure they're getting appropriate nutrients and appropriate calories in, as well as managing their stress. So, it's a stressful world out there now regardless. And then on top of dealing with the pandemic, having this type of diagnosis indeed is additionally distressing. So providing resources for patients to be able to use integrative modalities to help reduce their stress, improve their sleep, and just improve their overall quality of life. And then one area that sometimes is overlooked is that of spiritual health and well-being. And so, partnering with patients, connecting them with the chaplain, not necessarily that, somebody has to have a specific religious belief, but we all are spiritual beings, and making sure that we can connect with a sense of meaning in our lives and really putting the whole change of having a cancer diagnosis in that perspective of who am I now and how do I relate in the world. So those are kind of all holistic ways that we try to bolster people as they're going into something like this.
That's a great breakdown, and what a great resource for patients to have available. Thank you. Our second question is, how can guided imagery meditation help bring positivity to a surgical experience?
So I love the resource of guided imagery meditation because it's kind of what I call the gateway meditation practice. Guided imagery is just listening to perhaps some background music and somebody talking to you while you're relaxing, maybe taking some slow deep breaths, and giving you suggestions of being strong, being in a good place, being surrounded by people who are there for your best well-being. And so patients can easily get recordings such as these. We have a great library that we refer people to, and they can listen to it. We recommend they listen to it at least once a day, if not, twice a day, and just get into the habit. It becomes not only a good stress management practice, but it also can help them moving into preparing for surgery. If the surgeon and the anesthesiologist are okay, sometimes people also like to listen to this during surgery, and it could be also helpful, post-operatively as well. So again, something that you don't have to have a whole lot of training or experience to use, but it can be very powerful in putting people in a good place as they prepare for a surgical experience.
Susan, this next topic is really exciting. So there is a program at LCI for patients. It's called the Kazoo Blues. It's very catchy and very innovative. And I am curious to hear from you if you could just give us a quick little overview about the program and how strengthening the breath prior to and after surgery can also aid in the recovery process.
So Kazoo Blues was a project that Dean and I came up with to put a fun twist on, strengthening breath work. And we know that people who have diminished lung capacity, oftentimes we're, encouraging them to do pursed-lipped breathing or paced breathing of some sort. And so humming and playing a kazoo helps them mimic those exercises. And certainly post-operatively, everybody's given one of those incentive spirometers where you have to try to make the little ball rise. And the kazoo is another way for patients to practice, keeping their lung space open as much as possible in, again, a more fun way. We're hoping that patients use their kazoos at home, both pre and post-operatively, to, maybe with their their family, their grandkids, just to, again, have a clinical intervention, but something that doesn't feel clinical. It's really fun. So I know Dean can talk a lot more about the Kazoo Blues. It's been a really fun project for us to work on, and we're excited to get the feedback from people on it and just to see, are we seeing some benefits as well.
Awesome. Thank you, Susan. That sounds like a terrific program, and we can't wait to see it in action. Appreciate all of your expertise and support that you and your team offer to patients. Thank you.
Thank you.
All right, Dr. Jeffrey Hagen, welcome to the hot seat. How are you doing today, Dr. Hagen?
I'm well. How are you, Claire?
Good, thank you. Dr. Hagen, if you could start by giving us an overview of recent surgical advancements, including any updates you might be able to talk about with robotics specifically.
I'd be happy to. So, lung cancer surgery, since the beginning of the history of lung cancer surgery, has been done through a big, painful incision in the chest. It usually starts back on your shoulder blade and comes all the way around to the front, spreads the ribs, divides several muscles, and it's really a painful, debilitating procedure. There's a lot of patients, when I talk to them, they tell me stories about their father or their grandfather or somebody that had this and how difficult it was. Beginning in around 1991 or 92, when laparoscopic surgery first came into common practice, thoracic surgeons started exploring with minimally invasive options in the chest. And starting around the year 2000, that started to become a commonplace procedure. But it sort of peaked out in about 30 or 35% of lung cancer operations, mostly because it was hard for surgeons to learn. It took a long time to master the technique, and there's a lot of physical demands on the surgeon to do this type of surgery. It's not very ergonomic. And then along came the surgical robotics. The first robotic surgical procedures were done around the early 2000s, but it really didn't come into common use until urologists and gynecologists picked it up and started doing their procedures probably in the latter part, close to 2010. In late 2010, the robotic surgery for lung cancer was first described by a couple of pioneer surgeons across the country. And it's really kind of revolutionizing the minimally invasive treatment of lung cancer. It's a shorter hospital stay, fewer complications, much quicker recovery, usually 3 weeks instead of 3 months, and earlier return to normal activities and work if appropriate. I started doing robotic lung surgery in 2011. That was a few years before I came to LCI. We've been doing it here for about a little over 4.5 years now. Many hundreds, more than 600 robotic thoracic surgical procedures to date in our program here.
Thank you, Dr. Hagen. Really tremendous to hear how things have changed and evolved in really not that much time, but what a relief for patients to know that they have so many better options compared to what it once was. So thank you for sharing that. Dr. Hagen, a lot of times when it comes to surgery, there are a lot of myths and misinformation floating out there. I'm sure you have heard it all from your patients, whether it's about pain or hospitalization time, side effects. Could you maybe share with us some of the more common myths that you hear and just use this as an opportunity to set the record straight?
Yeah, so I already kind of alluded to the first one, which is the pain. There's a lot of patients come to meet me to discuss the possibility of surgery, and they have their minds set against it because they have seen a friend, a family member, a loved one who's had lung surgery, and the traditional way of doing it, it was very hard on patients. And so to get their mind reset on the proper expectations of minimally invasive surgery, which we can do now about 97% of the time for lung cancer operations. And so that's the first thing, is just dispelling all of the, I wouldn't call them myths as much as preconceived ideas about what it's like. Another very common, and this one is in fact a myth, but it's something that I've heard countless times, is that, well, I heard that if you open someone up and expose their tumor to air, it spreads. It's a surprisingly common myth. I could tell you some reasons why I think that myth has been perpetuated, but basically it is categorically not true. There's nothing about opening a patient or doing exploratory surgery on them that leads to the cancer spreading. In terms of activity, again, it's less of a myth, but an improper preconceived or idea is recovery. Recovery time is much quicker than what most people expect when you talk to them about removing part of their lung. And most people get around for activities of daily life within about 3 weeks of the operation. If they work, that requires physical activity, it's a month, which really for major surgery is not that long of a period of time. We have protocols for managing pain and for care path while in the hospital called enhanced recovery programs that are focused on multiple modalities of pain control to minimize the discomfort associated with the procedure. And it involves probably 15 different medications, nerve blocks, other things we do to preemptively help control pain during the recovery. And so most patients, they're actually kind of surprised when I go to see them post-op, because they're like, it's really not that bad, but it's just, again, I think because everybody knows somebody who had lung surgery at some point, and it's not your father's or grandfather's lung cancer surgery.
That is very reassuring to hear. I'm sure when people hear it from you, that put that way, it's definitely like a sigh of relief. So thank you, Dr. Hagen, and for being just a huge pioneer when it comes to thoracic surgery. You're being very humble, but a lot of the things you talked about are really things that you have worked on and pioneered over the years. So thank you for being such a great advocate for our patients. Up next in today's discussion, we have Dean Quick, who is a board-certified music therapist. Hi, Dean. Welcome to the show.
Thanks for having me, Claire.
Dean, can you start by giving us an overview about what is music therapy?
Music therapy is the systematic and clinical application of music to affect and support movement towards non-musical goals. So this can include creating music with patients in the moment to express their feelings or emotions, or it can be a distraction. These are active music therapy treatment methods, but it can also be used in more receptive ways where I create music for the patients using things like music-assisted relaxation or lyric analysis, where we talk about the meaning of music for people. But most music therapy interventions are live music-based. So a recording can't change tempo or respond to a person's changing emotional state or respiratory rate. So that's a little bit about what music therapy is.
What is the difference between music therapy and just listening to your favorite music?
Though listening to your favorite music can affect your mood, you typically don't set clinical goals when listening to music in your car or at home or walking to work or wherever you are. There are some studies that indicate that there are positive effects of listening to music, just recorded music, though music therapy follows a systematic process of assessment, treatment, and discharge, where a board-certified music therapist implements a treatment plan to address goal areas for patients.
How is music therapy used to treat preoperative anxiety?
Depending on the individual, treating preoperative anxiety can be something like music-assisted relaxation techniques, which can involve breath work paired with live music, or more imagery or intention-based work from like that mindfulness-based work that people sometimes do. And sometimes the music therapist will work with patients to develop coping skills using music leading up to the surgery. And this can include creating a playlist of recorded music that they can listen to on an MP3 player or their mobile device, during which they utilize those skills that they practiced with the music therapist. And this is actually something to consider too, is post-surgery, the Kazoo Blues program that we recently developed as a part of our lung cancer support program initiative. Post-surgery, this Kazoo Blues program can work with pulmonary rehab or long-term maintenance needs for these patients.
Thank you, everyone, for joining us today. It was a great conversation. Thank you to all of our experts who joined us, Susan Yaguda, Dean Quick, and Dr. Jeffrey Hagen. We really appreciate your time and expertise. And to everybody who is going through a lung cancer diagnosis who found this at all helpful, please bookmark it or share it with a friend. We really appreciate you helping us get the word out. So with that, we will go ahead and wrap up our session today. Thank you and hope you all have a great day.